So this all leads that those decisions that I made to no longer take doctors' words for it, but to take matters into my own hands, find a baseline, and then go from there was absolutely the best decision I ever made. Since then, I've cut my meds in half 3 times. 3 times. We just did it again. And for years, I took a drug called amiodarone. This is important. I took this drug called amiodarone. Amiodarone is a drug that they use to stop your heart, essentially, to slow your heart down. And it's the only thing that worked for me when I was in AFib. Now, AFib is, when your heart is racing, in my case, sometimes 240 beats a minute for 17 hours. I would go into the hospital 140, 150, 175 beats a minute, and they couldn't stop it. Cardioverted me, knocking me out, hit me with the paddles, clear, and they hit you. Wake me up a half an hour later, right back into AFib. The only thing that worked was this drug called amiodarone. The problem with amiodarone is they like to give it to older people, not young people like myself. Number one, even though I have this compromised heart, I have a very strong heart, and I'm still young. And so the drugs eat your liver over time. So it's not a long-term, for somebody 75, it's okay. For somebody that's 48, it's not okay. But it was the only thing that worked consistently to stop my heart. There's other drugs. Diltiazem is another one that they would give me. And sometimes I would have luck with that, particularly through my IV. But generally speaking, my heart just decided it was going to run and run and run. And only amiodarone would stop it. Well, I'm happy to tell you that last year in July, we cut amiodarone in half from 200 milligrams to 100 milligrams. And as of 6 days ago, I have not had amiodarone. So fingers crossed. But if this works, I'm happy to be on 100 milligrams, better than 200 milligrams. But if this works, if I've been able to eat and exercise my way back to where, as somebody with a significantly compromised heart, 40% block in my left ventricle from from hypertrophic cardiomyopathy that then causes this AFib, and also an A-flutter. That's when your heart goes from 70 beats a minute to 145 beats a minute in one beat, which is just a knockout. It's very painful for me when that happens. Some people don't have pain. I do. It's like punching me in the chest. To not have to deal with that, and to have, if I've been able to fix that, which I have, because I've not had an event for over a year after having them almost daily for 10 or 12, 15 years, that's quite an accomplishment.